Hospitals in the province have plenty of issues on their plates already. Top of mind, overcrowding, hallway healthcare. Here's a number for you. Across the province, 10% of patients who go into the ER will be back within 72 hours. And it's oftentimes a visit they don't need. This morning, we're talking about what we can do to help avoid clogging up the ER. And we're joined by the Chief Medical Strategy Officer at Sinai Health Systems, Dr. Howard Ovens. And I had a firsthand experience, of course. This is what got this conversation started. I was in with my appendix in December at Mount Sinai in Emerge. It was busy. It was the holiday season. And it's something you'd like to see reduced because 10% is a fascinating number. And thank you for joining us this morning. There was a lot said there, but thank you for joining us this morning.
Good morning, Roger. Pleasure to be here.
That number, though, 10% of the people will return to the Emerge. What does that mean, first of all, to the system?
Well, so again, 1 out of 10 people seen today in the emergency department anywhere in Ontario will return within 72 hours for further assessment. Some of those visits are just related to the natural history of disease. Often early in appendicitis, as you experienced, the symptoms are very nonspecific and hard to distinguish from more benign ailments. And a day or two later, you feel worse, the pain is settled in a specific location, and it's good that you come back and we figure out what's wrong with you and we can fix it and you're back to work and looking hale and hearty. But sometimes the visits are avoidable if we really make sure that people understand the advice we've given them, that they know where to go for follow-up, that their questions have been answered. Then sometimes we can prevent those return visits.
What are some of the questions that people should be asking when they're in the Emerge and either getting ready to be discharged or have some concerns? What are some of the questions they should ask?
Yeah, so before you go home, you should understand what your doctor thinks is wrong with you, what their diagnosis is at that point, what they expect the natural expected course of your illness is over the next few days, what you can do to make yourself feel better, where you should go for your routine follow-up if everything goes well, and most importantly, what are the red flags? What are things that are unexpected that if they occur should bring you back to the emergency department for your own safety and well-being? So that's one thing we really stress. For instance, if we do send somebody home who's got a little bit of mild bellyache, some nausea, we want them to know that if they feel worse, if their pain becomes more severe, if they get fever, if they think they're sicker, that they really should come back and make sure we haven't missed something or something more serious hasn't developed.
And are there key questions that someone can ask?
Well, the main thing is to listen carefully to what you're told and don't be shy. Ask for clarification if you didn't understand, because we don't mean to talk in jargon, but sometimes you can't help it. You just use the language that becomes so familiar. And everybody's got a little different education and experience level. So if we say something you don't understand, ask. And if we hand you some written instructions, which is a good thing for us to do, take a few minutes, read it before you leave, and make sure you understand what you've been given. Because most people put it in their pocket, read it when they get home, and then it's not easy to get a hold of us for clarification.
And what is the hospital doing to try and make this a little easier for everyone and avoid those return visits?
So at the hospital level, we do stress to our staff good discharge instructions, and we have a large series of patient information sheets we hand out. But I'm leading a program provincially that I think is really one of the best in the world for looking at this issue. We take reports, create reports for each emergency department in Ontario of people who've returned to their Emerge in within 72 hours or even to another hospital and were admitted on the second visit, which is a marker that maybe whatever happened was more significant. And we asked them to review a minimum of 50 of those per year to see if there was anything they could have done on the first visit that would have prevented the second visit. They make those judgments themselves, but they have to get those reports signed off by their own CEO, their board, and they send them to us provincially where we analyze them and see trends that are going on across the province.
And which long-term will help make a difference with all that.
We think so, yeah.
And we have to go, but of course you always stress, if there are symptoms, don't hesitate to go back to Emerge.
We'd rather you come back, absolutely. Don't be shy. If you think something's not right, come see us again.
All right, Doctor, thank you very much for joining us this morning. We appreciate it.